Well, hello, good morning, good afternoon, good evening. I'm Marian Wentworth, President and Chief Executive Officer of Management Sciences for Health, or MSH. MSH is a global health nonprofit focused on partnering with governments, businesses, and civil society organizations to help improve the delivery of healthcare in countries. We believe in healthcare for all. MSH is 50 years old. It was founded 50 years ago. And at that time, we were aware that containing infectious diseases was going to be a major challenge of our time. Of course, the horrors of the 1918 flu pandemic were well known. And we could also foresee that there would be other pandemics, such as the one we're facing right now with COVID-19. We didn't know much about how it would come about, though. We were yet unaware that earlier in the century, HIV had already made its way out of chimpanzees and into its first human beings. Had we known that, I think the face of global health might have been a very, very different place than it is now, and that the story of the last few decades would also have been different. We now know that infectious diseases don't just spring from nowhere. Scientists think that 6 out of 10 of our known infectious diseases come from animals, and that proportion may actually be higher. When we destroy and invade wild animal habitats like forests and jungles, we come into closer contact with new pathogens for which human bodies do not yet have defenses. When climate change kills habitats, bats and mosquitoes migrate to new areas. When we farm huge numbers of animals in close quarters without proper precautions, when we dose animals indiscriminately with antibiotics and spray antimicrobials on plants, we are killing the effectiveness of our medicines and we're seeding the next pandemic. And as our population grows, exacerbated by climate change, the problems continue. Outbreaks happen at maybe 200 every year, but scientists really expect that that the number will increase, and the likelihood that they turn to pandemics will also increase. Throughout our 50-year history, MSH has worked for countries worldwide on all aspects of epidemic prevention, response, and recovery at all levels of the health system. We take a comprehensive approach, sustainably strengthening all of the structures, processes, and workforces involved in making health systems run. We collaborate with governments and partner in devising new solutions from local communities to global organizations. As we look at the next 50 years, we know the future of global health is planetary health. MSH is the kind of coalition builder that can lead these efforts, and hence we chose today's topic. It's clear we need to think beyond a traditional narrow definition of human health to a larger interconnectedness of planetary health. Strengthening health systems on the human health side is more than infectious disease preparedness or even universal health coverage, but we also must incorporate broad-scale pandemic prevention and containment. How can we coordinate human, animal, and environmental sectors to better support human health? Even within global health, we need to improve our collaboration and communication so that we can truly say we're preventing future outbreaks. We need to figure out a new infrastructure for this work. We need to get nonprofits on board and get governments committed, and we need to fund it. And that is the logic behind the choice of our speakers tonight. We've convened speakers from diverse areas, and I'm sure we will all find this discussion enlightening, and I think this will be the beginning of many future conversations. I'd like to start by introducing our keynote speaker, Jennings, Executive Director of Health. Oops, excuse me. I do want to get his remarks correct. Jennings, he's Executive Director of Health and Harmony, where he directs the international operations, representation, advocacy, and financial growth of a very unique nonprofit. Jonathan came to Health and Harmony in 2017 after 20-something years leading humanitarian and post-conflict crises at Doctors Without Borders. He became frustrated going to work every day dealing with the humanitarian fallout of a sick planet. Today, he focuses on drivers of climate breakdown and ecological collapse, particularly on interdependence between human well-being and global conservation. Jonathan?
Thank you so much, Marian. Your invitation to participate in this event today is a real honor for Health and Harmony. So I want to start with the bad news. In the geological nanosecond that the human species has existed, we've created a climate crisis and we've engineered the collapse of nature. The emergence of mass spread of viruses like COVID, SARS, and Ebola are the deadly symptoms of our destruction of Earth's life-giving ecosystems. As hard as it may be to accept, this coronavirus pandemic is the emergency within the emergency. Some 40% of Earth's land surface is now used for croplands and pasture, and approximately 50% of all tropical and temperate forests have been clear-cut and fragmented. This intensity of land use forces wildlife into closer, more frequent and novel contact with people, which means a greater probability of infectious pathogens being transmitted from wildlife into human populations. Zoonotic outbreaks like Ebola and coronavirus have made one thing deadly clear. The health of rainforests from the Congo to Indonesia and Brazil impact my family's health directly, whether we live in Jakarta, Johannesburg, or Geneva. The World Health Organization's definition of health as a comprehensive state of physical, social, and mental well-being implies interconnectedness to nature, yet global health practice for a century has focused narrowly on disease burden in one species, humans, mostly in a vacuum, neglecting our dependence on nature and the ecological determinants of our health. Meanwhile, in that same century, the life-giving ecosystems of planet Earth have all but collapsed. In the prophetic words credited to Chief Sialth of the Duwamish tribes here in the Pacific Northwest USA, where I live, quote, "Man did not weave the web of life. He is merely a strand in it. Whatever he does to the web, he does to himself. And one thing's for sure, humans are doing enormous damage to the web. Consequently, the very foundations of our economies, our food security, and our physical and mental health are eroding." Now, when we talk about pandemic prevention, very roughly speaking, we mean arresting pre-spillover dynamics related to wildlife trade or habitat destruction, or we mean strengthening our health system's ability to keep a few cases from ballooning into a full-on pandemic. Both of these are critical. However, I really believe both will require us to do something as groundbreaking as it is obvious. And this brings me to my first call to action today, and that is to expand how we comprehend human health. More specifically, I believe the theory and practice of global health should cease to be so narrowly focused on disease burden in the individuals and populations of only one species, and should expand to encompass our interdependence with nature. As Marian said, before joining Health in Harmony, I spent about 13 years in leadership roles with the medical humanitarian organization Médecins Sans Frontières, or Doctors Without Borders, responding to crises such as famine in the Horn of Africa, conflict in Syria, and the Ebola outbreak in West Africa, all of which are driven directly or indirectly by environmental degradation and the climate crisis. I left MSF because I just got frustrated going to work every day to deal with the humanitarian fallout of a sick planet. I believe the planet is the patient now, and its vital signs aren't good. But that said, here's the good news. There are scientifically proven, cost-effective, and scalable intervention models that can be rapidly deployed at spillover hotspots globally to reverse rampant habitat fragmentation and help prevent pandemics at their source. But here's the thing. These models, like ours at Health in Harmony, require something we humans don't do so well. Our models require interdependent, systems-oriented action and investment. And this brings me to my second call to action today. The global health and environmental conservation disciplines should no longer be siloed apart from one another. This separation is largely false. For one thing, it sets we human animals apart from nature and ignores basic ecological principles. In my humble opinion, practitioners of global health and conservation should combine forces and unite to execute systems-oriented interventions, guided by the principles and practice of this relatively new field of planetary health. Planetary health, as many of you will know, is defined as the health of human civilization and the integrity of the natural ecosystems on which our health depends. On which our health depends. That is a terrific operational distinction. Health in Harmony is a planetary health organization founded on the understanding that we've never lived in a world where the health of people, ecosystems, and the planet could be effectively addressed in silos. We are Planetary Health in Action because our work beside rainforest communities improves both human health and rainforest health. Our mission is to reverse the deforestation of tropical rainforests. And the way we do that is somewhat unique, if not disruptive. First, and most importantly, we understand that when it comes to knowing how to live in balance with rainforest ecosystems, local, indigenous, and traditional rainforest communities are the experts, not us. So we enter these communities and we practice a methodology we've developed called radical listening. Radical listening starts by asking rainforest communities this simple question. We say, you are the guardians of a precious rainforest that impacts the health of the whole planet. How might the world community assist you to live in balance with this rainforest as a thank you for your guardianship of it? Then we listen, documenting the various activities that, once combined, will allow these people to put down their chainsaws and stop logging. In 2007, at our first site, our proof of concept site in West Kalimantan, Indonesian Borneo, we conducted around 400 hours of radical listening exercises with 40 separate communities bordering Gunung Palung rainforest. These communities concluded that they could stop logging if they had access to two things. First, quality, affordable healthcare. And second, jobs training in alternative livelihoods. They taught us that they had no other economic opportunity except to cut down and sell rainforest trees for the cash they needed to survive. And the critical driver was to be able to afford the out-of-pocket costs of their healthcare and medical emergencies. The connection between human well-being and ecosystem integrity was that direct. And it's a reality we see in tropical rainforests from Brazil to Madagascar to the Philippines. So that's exactly what Health in Harmony did. We trusted their guidance. And in 2007, we invested precisely in their systems-oriented solution. We established a medical clinic on the edge of the rainforest, and we initiated jobs training in alternative livelihoods, mainly in organic farming, to justly transition thousands of loggers into safer, better paying jobs. Communities designed reciprocity agreements whereby villages receive discounts on the cost of healthcare at our clinic, commensurate with the reductions in their rates of logging. And they ensured that even the poorest people amongst them could access healthcare with non-cash payment options like rainforest seedlings, which are used in our reforestation initiatives. And these communities were right. And Sarah, if you could show the graphic. These communities were right. Today, we have the data to prove that our model worked quite well. We gave the first 10 years of our program data to scientists and researchers at Stanford University. And their analysis culminated in the publication a few months ago of our 10-year impact in the Proceedings of the National Academy of Sciences here in the United States. Between 2007 and 2017, Health in Harmony's investment of $5.2 million US into the community designed solutions resulted in, first, a 90% reduction in the number of households reliant on logging as their primary livelihood. This reduction in logging prevented $65 million US worth of above ground carbon from being released into the atmosphere. It also allowed 21,000 hectares of forest to regrow. Now, this forest, as all of you will know, is critical habitat for biodiversity and for the population of critically endangered Bornean orangutans which live in this forest. So we saw the improvement and the expansion of the habitat for this extraordinary biodiversity. Finally, Infant mortality fell 67% in our clinic's catchment population of about 100,000 people. And there were significant declines in the prevalence over time in diagnosed cases of malaria, tuberculosis, and diabetes. We trusted the people of Borneo's wisdom, and they quite naturally designed a new kind of health system, one that links their own well-being to the well-being of their rainforest ecosystem. Or, to borrow the words from Chief Sealth, they regenerated the web. Sarah, if you could stop sharing. This work demonstrates an operational framework to simultaneously achieve multiple sustainable development goals related to poverty reduction, nature conservation, pandemic prevention, and improved human health. We are currently replicating our model beside rainforest communities in Southeast Madagascar and inside the Brazilian Amazon at the Xingu River Basin. And we're attempting to persuade governments and multilaterals to invest in planetary health approaches like ours. Potentially game-changing models like the one I've described exist. They can be quickly scaled up to reverse the destruction of nature and to help prevent zoonotic outbreaks like COVID. Governments and the private sector can finance interventions like this through the emerging carbon and biodiversity valuation markets. And more than anything, this is a story of hope. It's a story of restoring agency to the experts at protecting nature. And it's a story of facilitating the transfer of global wealth back into these rainforest communities from whom so much wealth has been stripped. This is the moment for a revolution in global health. Now is the time to adopt a planetary health framework in global health theory and practice. Most importantly, now is the time to operationalize humanity's interdependence with nature and build smarter healthcare systems like this one in Borneo. Doing so is a pathway to restore nature, subvert poverty, prevent pandemics, and stabilize our climate. Thank you very much, Marian. Back to you.
Thank you, Jonathan. Oh my gosh, what an inspiration and so important. I was raised on the notion that we are stewards of our body, but we are stewards of our planet and stewards of each other too. Thank you so much. We're going to introduce I'm going to introduce our panelists and allow them to make some introductory remarks as well. Before I do, I'd like to remind you, I wrote a note in the chat box, but for those of you who didn't look at it, please use the chat box as a place to place your questions. We have some lovely individuals who will be gathering up those questions, and we'll see how many we can get to during the Q&A session. Now I will introduce all of our panelists and our final speaker all at once. Starting with, we will hear from Neil Vora. He is a physician with Conservation International, where he leads efforts on pandemic prevention through addressing the underlying drivers of pathogen emergence, such as deforestation. Dr. Vora was previously an epidemic intelligence service officer with the CDC, where he deployed to Liberia and the Democratic Republic of the Congo to assist in responses to the two largest Ebola outbreaks on record. Dr. John Epstein is the Vice President for Science and Outreach at EcoHealth Alliance. He is a veterinarian and epidemiologist. His research focuses on the ecology of zoonotic viruses, including Nipah, Ebola, and coronaviruses like SARS, MERS, and SARS-CoV-2, which causes COVID-19. He has also been a consultant for the World Health Organization, the National Academy of Medicine's Forum on Microbial Threats, and the Smithsonian's Museum of Natural History, where he co-created the exhibit Outbreak: Epidemics in a Connected World. Reuben Kiggundu is a longtime public health professional and country project director of the USAID Medicines, Technologies, and Pharmaceutical Services Program in Uganda, which MSH leads. He helped establish the National Health Security Program in Uganda, supporting other African countries in the process. He also supported the implementation of the CDC's Global Health Security Project in Uganda with a focus on antimicrobial resistance. Francoise Vanni is Director of External Relations and Communications at the Global Fund to Fight AIDS, Tuberculosis, and Malaria. Vanni has more than 20 years of leadership experience in resource mobilization and advocacy, most recently as Director of External Relations and Communications for the United Nations Relief and Works Agency in the Middle East. Earlier in her career, Francoise served as a country representative in Angola and in Cuba for Médecins du Monde. Finally, and not lastly, we will finish our remarks today by hearing from a personal experience, a really important one. Kristin Urquiza is co-executive director of Marked by COVID, which she co-founded after her father passed away unnecessarily from COVID on June 30th. Marked by COVID is a national grassroots-powered nonprofit that promotes accountability, recognition, justice, and a pandemic-free future by elevating truth and science. So with that, we've asked each of our panelists to prepare their initial remarks for us, and we will begin with Neil Vora. Neil?
Thank you so much. I really am honored to be on the panel with so many esteemed colleagues, and it's a tough act to follow behind Marian and Jonathan's very inspirational remarks. I'm going to be providing an overview of pandemic prevention. I want to start by making the point that we know very clearly that new infectious diseases are on the rise. This is a trend that has been happening since at least the 1940s. And most of these new infectious diseases originate from animals because viruses naturally circulate in animals. And as humans interact with those animals, there are opportunities for spillover of that virus in animals to then go into people. And in addition to the fact that most of these new infectious diseases arise from animals, it is particularly wildlife from which these new infectious diseases are arising from. The list of new infectious diseases is very long, right? It goes back decades upon decades where we've discovered new virus after new virus. And oftentimes, these new infectious diseases can have huge consequences when they spill over into people. Examples of such high consequence zoonotic diseases include SARS back in 2003, Ebola, monkeypox, Zika probably originally originated from an animal, HIV, novel influenza viruses that cause pandemics, and also COVID. Most experts in the field believe that COVID originated from an animal and then spilled over into people. And so it begs the question, why are new infectious diseases on the rise in people? And that's related to the rise in unsafe human-animal interactions driven by human activities. And there's really three categories of human activities that are driving the spillover of animal viruses into people. The first bucket of activities is deforestation, similar to what Jonathan was saying before. Whereas people clear rainforests, we are creating opportunities for people to increasingly interact with wildlife in ways that they were not doing before. And that provides the perfect opportunity for the wildlife virus to spill over into people. And I'm not saying that biodiversity therefore leads to pandemics. In fact, biodiversity is protective against outbreaks, epidemics, and pandemics. But what's happening is as we clear forests, we are creating the opportunities for that virus, for those viruses to then jump over into people. The second category of activities that drive new infectious diseases is the commercial wildlife trade pipeline, both legal and illegal. And again, as people are taking wildlife from natural habitats and then putting them into some type of commercial wildlife trade, we are creating opportunities for those wildlife viruses to then jump over into other animals that are also a part of that wildlife trade, and also to jump over into people. And we've seen examples of this time and time again, including possibly COVID. And then the third category of human activities that is leading to the emergence of new infectious diseases is poor biosecurity around animal husbandry. And I'm not saying that animal husbandry is bad, but what I'm saying is the conditions in which we do industrial animal husbandry has created opportunities for pathogen spillover from wildlife into those domestic animals, causing outbreaks in those animals, and also spillover opportunities into people. So it is imperative that we work towards a reformed global health architecture in which we prevent outbreaks. And then when outbreaks occur, we prevent them from becoming pandemics. Now, I am so thrilled that at the highest levels of government, we are now hearing calls for a reformed global health architecture, despite decades upon decades of experts calling for a need for more pandemic prevention. The unfortunate thing is that, and we saw this in the past week at the World Health Assembly, the focus is really on preventing outbreaks from becoming pandemics. Now, that is absolutely important. We will always need initiatives focused on preventing outbreaks from becoming pandemics. But what I have not heard enough about is actually preventing outbreaks from happening in the first place. And we need to start investing in that because only focusing on preventing outbreaks from becoming pandemics is insufficient. There will be some future infectious disease that will outsmart our public health measures, and we're not going to be able to contain it from becoming a pandemic. That is why we should just prevent those outbreaks from happening in the first place. And my colleague, Dr. Epstein, can explain more about some of those specific interventions that are needed to prevent outbreaks in the first place. But just going back through a little bit of history, in the past 102 years, we have had 7 pandemics at least. 4 of those pandemics have been from influenza viruses, 2 of them have been from coronaviruses, and the 7th one was HIV. Each of these pandemics have been the result of spillover of animal viruses into people. And in total, they have caused over 70 million people to die. So clearly, the impact of these infectious diseases that originate from animals is profound. And it is imperative that we prevent these outbreaks from animal viruses into humans in the first place. As we proceed with any type of reform global health architecture, particularly when we're talking about preventing outbreaks or preventing outbreaks from becoming pandemics, we must always prioritize equity. We know that environmental degradation and its impact on human health is an issue of equity. The people who are often least responsible for environmental degradation are the ones who are most susceptible to its adverse effects. So when we are trying to prevent future outbreaks, we must make sure that we prioritize equity as we develop solutions to the underlying drivers. And that's why I love the examples that Jonathan gave with the work with Health and Harmony about making sure that equity is prioritized. And we also need to prioritize equity in the health benefits we seek to secure. So in closing, I just want to emphasize the point that infectious diseases will surprise us. I've worked for the past decade in public health, and in my own experiences with Ebola, Zika, COVID, and numerous other infectious diseases, I've seen time and time again how infectious diseases have secret mechanisms that we cannot expect a priori. And we need to therefore also focus on preventing outbreaks in the first place so that we're not going to risk outbreaks from spiraling out of control and becoming epidemics and pandemics. We also know that the next pandemic is most likely going to arise from an animal source that then spills over into people. So we have to correct the mistakes of the past, and we have to prevent future outbreaks by improving our relationship with nature. We have a broken relationship with nature, but we have solutions that we can implement to fix this going forward. So thank you so much for having me, and I look forward to further discussions.
John, you're going to help us with how we do that?
Yeah, thank you, Marian. And Neil, thanks so much for setting the table for such an important issue and great discussion. I just wanted to wish everyone a good morning, afternoon, or evening, wherever you may be, and thank the World Health Assembly and MSH for inviting me to participate in this discussion, along with my esteemed colleagues. As we heard from Dr. Vora, now is the time for when the global health community has to increase our focus on preventing pandemics. We need a unity of purpose, collaboration, coordination, and a significant investment in preventing pandemics at the source. But to begin, it's important to understand that pandemics are not random chance events. We are not victims of circumstance. They're caused by human activities, as Neil mentioned, that influence the way that we interact with nature. Activities that bring us into closer and more frequent contact with wildlife reservoirs that carry zoonotic viruses like coronaviruses, influenza, Ebola, and others that we know have the potential to cause significant outbreaks. But over the past 10 to 15 years, we've developed a much better understanding of where in the world zoonotic viruses are most likely to emerge, so-called EID hotspots. And we have a better understanding of how they tend to emerge, which really helps us in developing strategies for preventing it. And we know that the majority of zoonotic viruses originate in wild animal populations. So the major drivers, the activities that we need to focus on that promote disease emergence, really promote spillover, that transmission of the zoonotic viruses from their wildlife host either into livestock or directly into people. And activities such as land use change, which includes forest degradation and fragmentation, intensified livestock production and wildlife trade, as Neil mentioned, are really the activities that drive the majority of historical zoonotic disease outbreaks, and we expect to continue to be primarily influential in future pandemics. And they're activities that bring us and our livestock into closer contact with wildlife. The problem that we're facing right now is that most pandemic preparedness plans do not include prevention of spillover at the source. And so the question is, how can we actually move towards prevention to prevent pandemics? And to talk about it, to frame the discussion, I think it's useful to look at examples of previous zoonotic disease emergence events that illustrate ways that we can think about prevention. And one example that I think really nicely illustrates the notion of how livestock expansion and intensification can be a risk for disease emergence was the emergence of Nipah virus. This was a zoonotic paramyxovirus that emerged in Malaysia back in 1998. It's carried by large fruit bats, which occur all across Asia. And this virus is fatal in people. To the tune of a case fatality rate between 40 and 75%, making it one of the most lethal viruses that we really know about. It originally emerged in pigs on a large industrialized pig farm in northern Malaysia. And as pigs got infected, they spread it to people. And then the epidemic spread throughout Malaysia through the movement of infected pigs. And the reason it happened in the first place was a combination of a large-scale intensive farm system with more than 30,000 pigs and the presence of fruit orchards, specifically that were planted next to the livestock enclosures. And these fruit orchards were an attractant to fruit bats that came in to feed on the fruit, which normally would feed in the jungle, far away from livestock. But it brought them in close. In the process of feeding on fruit, we're dropping pieces of fruit into the pig enclosures that were contaminated with excretia and occasionally Nipah virus. And that created the interface that allowed this bat virus to spill over into livestock and then humans. Now, the solution here ultimately, when the epidemic was controlled, was to mandate that in future farms had to have a buffer or spacing between any fruit orchards and livestock enclosures to prevent that same kind of literal spillover or interface that would allow wildlife and livestock to have contact. And it's this kind of biosecurity that is rarely considered in terms of large, developing, expanding farming systems and the potential for wildlife to come in and contaminate food sources and have indirect contacts with livestock. Now, although that was the last outbreak of Nipah in Malaysia, Nipah continues to cause annual outbreaks in Bangladesh. And there, spillover occurs directly from bats to people via cultivated date palm sap, which is a sweet, sugary drink cultivated by carving the bark off palm trees, allowing the sap to run down the trunk of the tree overnight into clay collection pots. And overnight, bats that carry Nipah virus also come and feed on that sap and occasionally contaminate the sap with excretia and Nipah virus as well, which is how people get exposed. Now, so far, Nipah virus has caused small self-limiting outbreaks, but as I mentioned, it carries a very high case fatality rate, and it is transmissible from person to person. And what we still don't know and really understand fully well is the breadth of different strains that exist circulating in bats, some of which may be more transmissible should they emerge in people. So there's a real imperative to prevent spillover there so we don't see any of those strains have the ability to emerge. Of course, the original SARS coronavirus is a great example of how wildlife trade influences disease emergence. It emerged in southern China in 2002 through live animal markets in Guangdong, China. And I think it's really the clearest example of the risks involved when we bring various wildlife species and domestic animals together under highly stressful and unhygienic conditions in an urban commercial live market setting where there's plenty of opportunity for animals to be exposed to each other's viruses and excretia, for transmission to occur there, and of course also for zoonotic transmission to occur to people who are handling these animals, butchering them, and getting exposed to bodily fluids. And we know that when viruses do jump from species to species, including into people, they have the opportunity to evolve and adapt. And we've seen that with SARS-CoV-2 as new variants have arisen in the course of it circulating both among people and jumping from people into animals like mink, which have forced evolution. And of course, HIV, as Neil mentioned, one of the most significant zoonotic pandemics in our history, is a virus originally carried by chimpanzees and other primates, which made its way into people via bushmeat hunting and through butchering. And so all of these things are behaviors that are continuing to occur around the world, and in fact are growing as we expand human populations into natural systems, and there's increasing pressure for animal protein and for resources. And so it's by no means easy to change the behaviors that lead to disease emergence, but this is really where we have to focus in order to prevent spillover, where the risk is highest. To prevent pandemics, it's going to require better international coordination and collaboration among intergovernmental agencies, between national governments and health and environmental agencies, working with local scientists and local communities in the places where spillover risk is highest. And this is what we're really beginning to understand well, is where the spillover risk is highest so that we can target interventions. It's critically important to understand the cultural context contexts for high-risk behaviors, and to figure out ways to meet the basic needs of people, as Jonathan nicely mentioned in his keynote, people who depend on wildlife or forest resources for their livelihoods, so that we can limit the activities that precipitate spillover and disease emergence. We're starting to move in the right direction in terms of how we think about health and pandemic prevention. We do see governments adopting One Health strategies, such as the One Health platform in Bangladesh, a newly launched One Health initiative in India. We've seen the recent creation of an independent One Health high-level expert panel, which is convened by the tripartite along with UNEP. And we're seeing new investments in One Health by the World Bank. So these are all encouraging signs. There are also ongoing and new research and development programs focused on building capacity to prevent and respond to zoonotic disease outbreaks. Programs like USAID's Emerging Pandemic Threats Program, France's new PREZODE program. But the main problem is these efforts are too few and too limited in scale to achieve the impact we really need. What we need is a much larger, more internationally coordinated and collaborative multilateral effort to reduce the risk of spillover by reducing the activities that drive outbreaks across EID hotspots, where we know the risk is highest. This is going to require participation and cooperation among national and local agencies, organizations across disciplines, human health, animal health, wildlife and environmental agencies, and many other stakeholders under a One Health framework with substantial and sustained investment by the international community using a mechanism like the Global Fund so that rather than having short-term or smaller scale efforts that simply serve to put out fires, we can have an effective long-term global effort that will prevent them. So with that, I look forward to our discussion today as to how we can meet these challenges together as a global community. Thank you, and back to you, Marian.
Thank you, John. Very clear calls to action and very important ones. And speaking of action, I think Reuben can talk about what it's like to work on the ground, and in particular from Uganda. So Reuben, over to you.
Thank you, Marian. Good morning, good afternoon, good evening, everyone from Uganda. For those of us who don't know where Uganda is, we are located in Eastern Africa. So I'm very happy to be part of this event, and I'm going to share our experience from Uganda in using a planetary health approach to strengthen more sectoral collaboration and take action to respond to the global threat of antimicrobial resistance. So briefly about antimicrobial resistance, we all know it is an emerging global health issue. Antimicrobial resistant bacteria currently kill about 2,000 people per day, between 2,000 and 2,500 globally, which is about 700,000 deaths per year, according to the Jim O'Neill report. If we don't take action, clearly we are going to lose all the investments that have been made into global public health. And by the turn of the century, if we don't take action, if we don't find new antibiotics or preserve what we currently have, the global economy is going to grossly suffer to the tune, currently it is projected to the tune of $100 trillion in loss to economies. And clearly, most of this loss is going to mainly affect the most vulnerable people and the poor countries. And most of this mortality is going to happen in those countries. There is a clear linkage between antimicrobial resistance, planetary health, zoonotic health, because many of these bacteria clearly come from the water and environment, they come from the animals and then cross over to the humans. It is also an issue of food safety and food security because antibiotics are clearly very important to the food production systems and to the other species on the planet. So it goes beyond the human health and it's important for the well-being of the entire planet, like Jonathan highlighted. So with this in the background, we started implementing activities in Uganda to respond to the emerging threat of antimicrobial resistance. Again, this was mainly based on anecdotal evidence, but clearly in Uganda, we had evidence that antibiotics for some reason were beginning not to work. And in 2014, we established what we call the National Antimicrobial Resistance Committee, focused on the human health sector. At that time, we didn't clearly appreciate the need for more sectoral collaboration and having a one health approach. However, when this work was started, many people started coming on board because of the interest that was generated from the data. And we started to pick information and data from the agriculture sector, from the water and environment, of crossover use of antibiotics meant for human health in the other sectors. So we found drugs that are important for human health being grossly misused in the agricultural sector, and we found spillage into the water and environment. So it was very clear at that point that we had to move together. We couldn't continue working in a siloed manner or approach. And good enough, in 2016, the WHO recommended that countries should use a more sectoral collaboration approach as they set up their national antimicrobial resistance control programs. With that in mind, we widened the scope and brought other key line government ministries on board to join the Ministry of Health to strengthen these efforts to contain antimicrobial resistance, working across all sectors, and to think about health more beyond human health, but thinking about and considering the other contributors to human health. We brought on board the Ministry of Water and the Environment, again, because of the obvious spillage of antibiotics into the environment. We brought on board the Ministry of Agriculture, Animal Industries, and the Uganda Wildlife Authority, which is responsible for tourism and the wildlife in the country. And we developed a strategy, the One Health Strategic Plan, that we are currently using for implementing these activities. From that point onwards, that is from 2017, we've been able to achieve activities and make progress, build a stronger foundation for One Health and more sectoral collaboration approaches to addressing global health security issues. We've been able to come up with national action plans for health security. We have a national action plan for the containment of antimicrobial resistance, and we've conducted key foundation building activities to build structures, to define roles and responsibilities in a One Health approach to respond to the threats of antimicrobial resistance, which clearly transcends human health. Good enough, we've been able to, to strengthen this work, bring partners on board, funding from the CDC, from ESG, and the government of Uganda. And with this background, we've been able to use this as a platform to respond to various disease outbreaks. Uganda happens to be prone to disease outbreaks. We border the DRC on the western part of the country, and to the north we have Southern Sudan. So we get a lot of movement and a lot of outbreaks coming into the country. As a call to action to this, of course, as we implement this work, I can't say we've known hard challenges along the way, but to further add to what the previous speakers have mentioned, we clearly need to come up with stronger policy frameworks to strengthen more sectoral collaboration and approaches as we implement and approach global health security issues and public health. We still have some challenges of conflicting policies within the government, but again, this is based on how the system was previously set up. So we need to realign and kind of go back to the drawing board and redefine what we want to achieve and how we want the government to work together to advance the agenda of global health, because clearly continuing to work in a siloed approach, when we know what affects the agriculture sector, water and environment, what affects education, transport affects human health, I think that won't bring us much success as we move into the next 50 years of programming. Thank you. Over to you, Marian.
Great, thank you, Reuben. It's exciting to see a multi-sectoral approach happening in one geography. I'm going to transition from multi-sectoral to multilateral. That's my attempt at a segue. And Francoise, over to you.
Thank you very much, Marianne, and thank you to MSH for organizing this fascinating panel. It's quite humbling to speak after my fellow panelists, but I will try. Perhaps to get us started, just to introduce the Global Fund briefly. The Global Fund was founded 20 years ago. We actually celebrate our 20th anniversary this year, in the midst of an out-of-control AIDS pandemic, as you would certainly recall, with the urgent mission to help countries confront what were by then the world's largest infectious disease killers. So as of today, we invest over $5 billion a year in programs that are run by local experts to fight HIV, tuberculosis, including multi-drug resistant tuberculosis and malaria, and also to build resilient and sustainable systems for health in around 120 low and middle income countries. So this makes the Global Fund the largest multilateral funder of prevention, testing, and treatment activities for infectious diseases. One of the things that characterizes the Global Fund, and that is linked to some of the things we've discussed, is that we engage with civil society, communities, the private sector, and governments in our governance structures, whether it is at country level or at our board level. And we proactively support gender equity and human rights in our grants, and very much prioritize key and vulnerable populations in all of our work. So I will speak a little bit about the COVID-19 response of the Global Fund and how we contributed to that. So as soon as the COVID-19 crisis started, a little bit more than a year ago now, the Global Fund stepped up to play a leadership role in the global response for two key reasons. One is that the COVID-19 presents obviously an existential threat to progress against AIDS, TB, and malaria. It basically threatens to take us backwards many years. And secondly, because the Global Fund already had the capabilities needed to tackle COVID-19, and therefore we felt a responsibility to act rapidly to save lives. So building on our investment in AIDS, TB, and malaria programs, the Global Fund was able to pivot at the beginning of the COVID-19 crisis to help countries swiftly respond to this new pandemic. We quickly mobilized a little bit more than $1 billion in 2020 from both existing grant savings and new donor contributions. The Global Fund has now become the primary channel for providing grants to low and middle income countries for COVID-19 tests, treatments, including oxygen, personal protective equipment, as well as critical activities supporting for health and community systems. Many G20 nations have backed the Global Fund's approach to fighting COVID-19 and protecting the gains against AIDS, TB, and malaria. Worth noting today, obviously, the US government recently endorsed the Global Fund's pandemic response capabilities by committing $3.5 billion to the Global Fund's COVID-19 response that was in March this year. We are now rapidly approving awards to low and middle income countries to help them contain the virus, protect healthcare workers, and treat patients. At the beginning of May, we awarded $75 million to India to assist the country with urgent oxygen needs, and we continue to assist other countries as I speak. The Global Fund is also playing a leading role in what is known as the ACT Accelerator, which means Access to COVID-19 Tools Accelerator, which is a partnership. And in that space, the Global Fund is a co-convener of what is called the Diagnostics Partnership, alongside FIND, the Foundation for Innovative New Diagnostics. We also coordinate the Health Systems Connector alongside the World Bank and WHO. And we play also a key role in procurement and deployment in the Therapeutics Partnership. In other words, we are involved in all the dimensions of the ACTA agenda except for vaccines, for which our friends at Gavi are playing a similar role to that of the Global Fund in the other areas. So in fact, when it comes to pandemic preparedness and response, many of the components of the Global Fund's AIDS, TB, and malaria grants over the years have indeed served as building blocks of pandemic preparedness in our partner countries. These elements include strengthening lab infrastructure and capacity, disease surveillance capabilities, procurement and supply chain operations, and supporting community health workers in particular. So just as an example, the AIDS, TB, and malaria platforms also help countries in West Africa be better prepared for Ebola. And they are now helping many countries fight COVID-19. Testing capabilities for COVID-19 build on existing infrastructure for TB and HIV testing, for example, while vaccine distribution campaigns build on bednet distribution networks to prevent malaria. A January 2021 study, which was published by The Lancet, determined that over 1/3 of global fund investments promote health security. Our grants help countries prepare for, detect, and respond to health emergencies by funding, as I mentioned before, laboratory systems, effort to fight antimicrobial resistance, and the deployment of medical countermeasures and personnel. So as a call to action, and while governments, multilaterals, and other actors in global health are now considering the future of pandemic preparedness and response, our suggestion from the Global Fund experience would be for them to keep the following in mind. First, our efforts to strengthen health security should not only build stronger and more agile systems to prevent, detect, and respond to new disease threats, but should also deliver concrete benefits in the fight against existing diseases. This is not only the moral thing to do, but the truth is that we won't have sufficient buy-in from pandemic preparedness efforts from many countries and communities if we don't accelerate efforts to end the pandemics that affect them today, AIDS, TB, and malaria. Secondly, like muscles, health security capabilities work best when used regularly rather than when held in reserve. Integrating pandemic preparedness and response capabilities, infrastructure, and personnel in regular health services helps countries get ahead of emerging pandemics. From former CDC Director Tom Frieden recently observed, and I'm quoting, "The most effective emergency response systems build on robust, scalable systems that respond to everyday events." That is very clear. The third thing that we would like to highlight in terms of the current debate is that community organizations and networks play an indispensable role in pandemic preparedness and response, and they are often overlooked. Health security should advance community engagement, gender equity, and human rights. We have seen with COVID-19 that mobilizing community systems is just vital for getting local buy-in for test and trace strategies and to combat vaccine hesitancy. Communities expand the reach of services far beyond formal health facilities and empower people to advocate for their rights and hold their government accountable. I'll stop here, and I very much look forward to the conversation with you all.
Super fantastic. Thank you. Merci, Francoise. We have a host of questions and we have a few minutes to get to them. And I want to start as a preamble with, first I'll actually start by reminding individuals that you still have an opportunity to put your questions in the chat box. We may not get to all of them, but we will certainly try. And as a preamble, I will say that almost every questioner started by thanking the panelists for their important and edifying remarks. And let me repeat that as well. This has been quite a treat and quite an education. So thank you for that. I'm going to put the first question to Jonathan. And that is, you've done some amazing work in the West Kalimantan, and it's effectively being taken up by key stakeholders. This is a blend of a couple of questions. So the first is, can you address how you feel about the sustainability of that effort and how it can be sustained in the long run? And also, perhaps as extra credit, if you could remark on how financial markets could support future efforts.
Thanks, Marian, and thanks for all of the great questions that came through the chat. Well, I think the answer is the same for both of those. I think we have got to thank ecosystems and even the species within these ecosystems for the services they provide for our species. So in the results of our work, I quoted that we protected $65 million US worth of above ground carbon. Who protected that? The communities and the government. First and foremost, the communities and the government. Answering the question about the financial markets is beyond my pay grade, but there are people on the call and certainly people out there who can do this and who are working on this right now. The carbon market is maturing. The valuation of biodiversity is maturing. And I don't intend to imply that we need a capitalist approach, but I do believe that the markets do need to value natural capital, and within the ethos that our species exists and our species can only flourish if the sources of this natural capital are also existing and flourishing. And so I think the markets need to address that in the ways that they will do in a win-win approach. And therein, I believe, is part of the recipe, if not the recipe, for sustainability.
I think that's a call to action to financial markets too.
Mary, can I jump in here as well?
Yes, absolutely, John, go for it.
It's really interesting to talk about the economics of conservation too, where ecosystem services have traditionally been such an important rationale for doing it. But we had a recent interesting experience. We did a 3-year pilot study, coincidentally also in Borneo, but in the state of Sabah, trying to speak with global industry and state governments that are actively participating in land conversion, in this case for oil palm plantations. And we were able to work with economists to model what the potential costs would be, in other words, the damages that would be associated with clearing land where there was a particularly high risk of disease emergence. So adding in a new element or a new factor into economic modeling for businesses, bottom line, is that what if you clear certain parts of rainforest and unleash an epidemic that impacts your workforce, your industry, shuts things down, creates a public health burden to the state or federal government? All of those damages can be factored in and indeed predicted. And we were able to share these models both with private sector partners and with state government in Sabah and get real traction with the idea that you could selectively choose areas of land that were perhaps less biodiverse and therefore less risky in terms of pandemic emergence as areas to cultivate rather than biodiverse rich areas, which would serve both to protect biodiversity and also health, and also the bottom line of industries too. And that was an interesting exercise because we did get real traction both with the state government's land development board, as well as some of the global conglomerates that are involved in developing plantations, say for palm oil. So there are economic angles here to think about when we factor in health and the potential damages that occur from land clearing. And to talk with private sector specifically, who are, in addition to communities, they're major stakeholders in land use because they're often the ones who are buying and converting land for economic purposes. Thanks.
Thank you, John. And I'm going to insert my own opinion here. Having spent more than 25 years at a Fortune 100 company as one of those private sector individuals, when we pit health or One Health is juxtaposed against economic gains, we are taking an incredibly short-sighted view. And sometimes we're not even taking a correct short-sighted view. And I think more corporations are starting to appreciate that. And I think more businesses are starting to appreciate it, but not fast enough. So anyway, thank you for adding that piece. I did want to get to another question. And this is about the notion of One Health and a pandemic treaty. The question is, what opportunities could a new pandemic treaty bring for operationalizing One Health and ensuring that animal health and planetary health are given the attention they deserve? And I'll put this out to anyone who'd like to start first.
I can take an initial stab. I think the One Health approach has so much value because it emphasizes the interdisciplinary approach that we need to to take when dealing with public health issues. It's about combining human health, animal health, and environmental health. And generally speaking, One Health has been applied to infectious diseases, but it's beyond that. Everything that we do in conservation actually comes back to have human health benefits because people need nature to survive. So whether you're talking about climate change, preserving biodiversity, saving oceans, that all has human health benefits. So in general, I'm the biggest fan of One Health. I do have concerns that One Health is too often narrowly applied and only applied to after a spillover event has happened and then there's an outbreak. That is when One Health comes into play in practice. And my observations are that if you have an outbreak response team and there's a veterinarian on the team, people say you're suddenly doing One Health. And again, that is just too narrow. We need to be going further upstream, broadening the dialogue and thinking about what is the value of saving rainforests in preventing future outbreaks? What is the value of stopping the wildlife trade that leads to outbreaks in preventing the next pandemic? And that is how I think we're going to truly fully utilize the importance of One Health. On the topic of the pandemic treaty, again, I think there's so much opportunity here for reforming the global health architecture and saving lives down the road. My concern is that a pandemic treaty needs to be at a level that is not just focused on the public health sector, because the public health sector alone does not have all the answers. The answers will also need to incorporate the perspectives of OIE, so the Animal World Health Organization, the UN Environmental Program, FAO, the Food and Agricultural Organization, and also, of course, the World Health Organization. And so it's very important that the pandemic treaty be at a level high enough to bring in all these different agencies, and that's how we're going to be able to incorporate One Health into the pandemic treaty.
Francoise, would you like to add to that?
Yeah, sure. One of the things that perhaps on One Health to start with, our board is currently considering how the next strategy for the Global Fund should look like. And one of the things that is coming up through their debates is the need to look at our work through a One Health lens, which is new, and particularly when it comes to our investment in health systems to make sure that we take into account this broader picture. How it's going to land in practice for the Global Fund remains to be further refined by our board and further down the road by the Secretariat and all the partners, but that's certainly a step that we have taken. And when it comes to the governance question and the treaty, one of the things that, we are absolutely, in a way, pleased to see that this crisis is not wasted and that, new reflections are coming to the forefront of the policy debate, and that this issue of pandemic preparedness and response is being looked at seriously. But we also have a concern that it might lead to creating new institutions and making the ecosystem even more complex than it already is. So we are looking at ways of making sure that the ecosystem works better and builds on the strengths of the different partners that already exist, similar to what we are doing in the ACTA partnership that I mentioned before, and look at what might be missing from that, but very much building on the strengths of the players. We think is probably what would take us faster further in the current context. Thanks.
Thank you. And I know I put you on the spot just a little bit, and I might do that again, although maybe I'll ask Reuben if he can start. The COVAX facility is the most advanced expression of cooperation. And yet, to a large extent, it's been challenged because of the national, many obstacles at the national level. What is needed to foster global cooperation across various borders? Reuben, do you mind starting there?
Yes, thank you, Marian. I will take that, but maybe just briefly about the previous question, maybe just to add on to maybe this may be an opportunity for us to rethink what we call One Health at the moment, because many key sectors, it is clearly coming out, are being left behind. If we just think about water and environment, animal health and human health. So getting other departments, government agencies and departments on board, housing, urban development, trade, and so on and so forth. Onto that discussion early enough, we'll have a major impact on the way we prepare and approach the next outbreak. Going on to the question of the COVAX facility and how maybe governments may best prepare. So I think what's important for countries, especially the LMICs, is to again to clearly think through how the long-term financing for outbreaks and preparedness is going to be approached. In terms of thinking about commitments from these countries, we know at some point we had the famous Abuja Declaration by African countries, which was a mixed success. But early on thinking, on top of having external funding for outbreaks, for vaccine response and preparedness to outbreaks, how do we get government commitments to finance future, vaccine delivery programs, or depending on how long COVID-19 is going to stay around, because for many countries, we know that uptake is really still low. For Uganda, we received 860,000 doses. So thinking about how long it is going to take to get a certain coverage of the population vis-a-vis the government coming up with commitments to finance the vaccine acquisition process. So on a global scale, maybe regional, we may have to think about governments committing to certain, percentages of national budgets to finance vaccine delivery programs, and maybe having a fund to support future outbreaks and responses. Over to you, Marian.
Yes, Reuben. So if you don't mind, I'm actually going to send the ball back to you again, because I think one of the questions around the COVAX facility was really that that there's challenges implementing national vaccine programs, some of which could potentially be addressed by better integration between national and COVAX, but also perhaps cross-border sharing. And I wondered if you had any comments on that now that I've stuck my opinion in there.
Thanks, Marian. Yeah, again, for some time, I think COVID-19 gives us an opportunity on how we integrate the national vaccine programs in view of emerging public health challenges and planetary health and future outbreaks. We still have national vaccine programs that are totally vertical and not looking out to address points of commonalities to address global public health challenges. It's good the system has been set up to, to deliver the usual childhood vaccine, vaccines, or the vaccine program for vaccine preventable diseases. But how does then this system early on think about integrating global health security challenges? So I think that's a discussion we've not yet had. And the COVAX mechanism, I think, if possible, could be maintained beyond this outbreak or fit into the Gavi mechanism such that we don't wait 14.5 years from now to think about another global vaccine delivery program for an outbreak. Thank you, Maria.
Yeah, I think that echoes some themes that you started, Francoise. Anything to add?
Yeah, I mean, obviously, when I hear about the extremely inequitable rollout of vaccines around the world, that reminds me of the history of HIV, for which we don't have vaccines, but we did take years and years and years to equitably distribute those life-saving tools that were being developed, right? So you had ARVs in the richest countries, and you had nothing in the low and middle income countries. And this is what the Global Fund, thanks to everyone's involvement and investment, managed to correct. And we just don't want to see that history repeating itself. And this is why COVAX and all the ACTA agenda is so important, because it is all about not only accelerating the development and deployment of life-saving tools against COVID-19, but ensuring that it is done equitably. So that applies to vaccines, but also to testing and other tools, because obviously without testing, we operate in the dark, and that allows the variants to proliferate at the pace we see. And as it has become now a very common thing to say, but no one is going to be safe until everyone is safe, right? So the equitable distribution of all the tools is of critical, vital importance at this point in time.
Indeed, of vital importance to all of us. I want to turn now to deforestation and other environmentally upsetting activities. A lot of deforestation is done by global actors, perhaps even more on the global basis than on the community level. Population growth has really put a lot of pressure on farming space. Anyway, you get where this is going. So can you comment what international efforts should be taken for a wider preservation of global resources on top of local efforts?
Well, maybe I could start there, Marian, and talk about building from previous comments about how important it is to engage private sector in this process. I mean, of course, there are really key agencies that are, are activist agencies working towards policies that will protect natural resources. There are on-the-ground efforts, but because of what you said, because private industry and global entities, pardon me, there's traffic in the background, but are responsible for a lot of land use change, and it's driven by consumer demand and financial interests, that we really have to have them at the table and work in ways that are amenable to doing business in a smarter way that is more sustainable, that there may be some concessions, but we can't just eliminate business practice entirely, because we're just not going to have any cooperation from private sector. So finding ways that, allow businesses to work, but work in ways that still protect natural resources and do things in a more sensible way will be important.
Thanks, John. Marian, if I could chime in, I just responded to a question in the chat, but I would like to draw attention to the fact that 69% of carbon loss in rainforests is due to local degradation and not clear cutting, not external commercial sort of global factors. And why is this? Well, it's because these communities are facing grinding impoverishment, and many of them are forced into these extractive behaviors to access cash in order to survive. So of course, degradation is more complicated than just human behavior. It also includes natural fires and things like this. But this paper that came out in Science in 2017 by some friends and advisors of ours at Woodwell Research Center, I think is very important to understand in the narrative, to understand that rainforest degradation, a big piece of this is due to the impoverishment that communities are facing across the tropics.
And if I can just add one comment on top of the two Jonathan and John's, which I fully agree with, which is that if you look in Brazil, and this is not necessarily my area of expertise, but rates of deforestation in the Brazilian Amazon declined from around 2005 to around 2012 through Brazilian-led policies. So these were local and national policies that Brazil developed within their own country, and that led to declines in deforestation without concomitant declines in development. And so it's a false dichotomy to say that to develop, you must clear your rainforest. There are actually ways to have both improvements in development while also preserving rainforests, and we need to find that sweet spot. I think the example of Health and Harmony is a fantastic one. I think John Epstein's point about private sector is so important. And sadly, though, more recently in Brazil, we've seen a decline in rates of deforestation associated with certain political decisions. But the point is that we can have both development and preservation of of tropical forests.
Great, thank you so much, Neil. Let's see, the next question I have is, how do we encourage interdependence in solving these huge problems in an ever competitive environment at the global and national level using extracting resources and including regulators and public policies. Any things you'd like to add on that topic? Francoise, is there more we can do to encourage global cooperation? Anything to add besides what you've said already?
Well, perhaps from our experience, what is very, very important in collaboration is always important because of all the interdependencies, right? So if I give just a concrete example outside what we are discussing today, but just to illustrate, in order to prevent HIV in young girls, you need to work in education, right? So these are the sort of things. So partnership and collaboration is really, really important to everything we are talking about today. So from our experience, having diverse partners around the table and good rules for collaboration is critical. And as I said, having communities not only executing, but actually designing the programs and responses is absolutely vital. But also having donor governments, implementing government, private sector, everybody really around the table is critically important. And then making sure that globally we collaborate closely, obviously, with WHO, with Gavi, which was also mentioned here, and all the global health, but also global development players to make sure that we build on our respective strengths. So this is what ACTA is about, the coalition I mentioned, because it brings together really science, private sector, governments, global health organizations, global development organizations. UNICEF, for example, is there as well, and the communities. And we have insisted a lot to ensure that civil society will be sitting at the table as well, to make sure that we build on the lessons that we've learned through those 20 years of work, particularly with HIV-affected communities.
Yeah, absolutely. Thank you. And I very much appreciate that. We're going to do just a quick round robin. If you wanted to, sorry, Reuben, did you have a quick comment to make on that one?
Yeah, well, thanks, Marian. I just wanted to mention that as we think about the collaboration, the private sector is very, very important, especially in the context of low and middle income countries, where the private sector is employing the biggest proportion of the population. Healthcare is access to the private sector. If you think about agriculture, the industry, but for some reason, it seems we consistently leave them out of the discussion. As we support develop surveillance systems, I won't think about the public health facilities and totally leave them out. But I think we need to bring the private sector on board at both national level and then on the global discussion. Thank you.
Great. Thank you, Reuben. And I appreciate that. I was going to ask each of you to offer one call to action in less than 30 seconds. And I'll do that in the order of speaking. And Reuben, you can cheat and say you just did that if you want to. But Jonathan, I'm giving you the least amount of time. What would the one call to action you'd like to leave people with?
I don't think that our current institutions are built for purpose, potentially. And so I would like all of us, be we multilaterals, be we small local CSOs or big INGOs, I would like all of us to take a good hard look at our internal bureaucracies and mandates and understand that vis-a-vis the twin crises of the collapse of nature and the climate crisis, we need significant action and potentially mission and mandate creep.
Thank you. Neil?
I'm saying this as a physician, right? But we have a broken relationship with nature that has led to declines in human health. And this is now in response to Sharon's comment, but there is massive return on investment in fixing this relationship with nature. The COVID pandemic has led to the loss of millions of lives and trillions of dollars. But for around $10 billion a year, we can actually address the causative drivers that lead to outbreaks in the first place, thereby preventing the next pandemic.
Thank you. John?
Neil took mine, but very well said. I guess what I would add to that is that we really need to recognize that everything we've been doing has been incremental in progress, but we need more radical action right now, which means a much more substantial investment on a global scale to address these issues which have been discussed today and that we understand well enough to actually take action towards prevention. So that requires a substantial investment of billions of dollars from G7 nations that can do this with the inclusion and cooperation and partnership with the countries around the world most at risk for disease emergence. So a multilateral, cooperative and collaborative approach with real teeth behind it in terms of funding. And then the last thing I'll add to that is in the whole One Health, Planetary Health discussion, the neglected partner is often the environmental sector or the wildlife sector. And we need to make sure that they are brought forward as participants in health in the same way that ministries of health and ministries of agriculture are, because wildlife are so critically important to well-being, but also to the process of pandemics, which we seek to prevent. So their inclusion is critical. Thanks.
Reuben?
Reuben.
Reuben, you're on mute.
Apologies about that. So I think the call to action here would be on a global scale and then for national, also for national governments to urgently address the policy bottlenecks that are still hindering the collaboration between the different sectors that are critical to planetary health and the health of all species. Thank you.
Thank you. Francoise?
Thank you. Global issues, global solution. So therefore, multilateral cooperation is key. Secondly, sustained investment is needed in prevention, and preparedness is always cheaper and has always a greater return on investment than in fixing the issues when they have become far too big. You can see that we are still 20 years after the creation of the Global Fund and still fighting. And lastly, equity is the key. Thank you.
3 for 1, a trinity. Thank you. All right. We don't do this for the fun and the intellectual stimulation, although sometimes we get that. We do this because there are people involved. And Kristin Urquiza has quite a story, and she's turned it into quite a mission. And I'd like to spend a couple of minutes listening to her. Thank you, Kristin.
Thank you, Marian. And thank you, everyone in the audience for joining us here today for this important conversation, the fellow panelists and MSH. It's quite an honor to be here with this group of individuals who are taking a step outside of your day to really dig into what do we need to do in order to really get to the root of this problem. And I want to go back to something that Neil said earlier today, that over the recent past, we've had multiple spillovers that turned into some sort of pandemic, resulting in 70 million people dying. And so far from COVID, we have lost, almost 3.7 million people globally. 3.7 million people. That's incredible. I'm here to talk about just one of those people for a moment. And I'm not going to use a slide, but I am going to share a picture. The man in the middle is my father. His name was Urquiza, and he died from COVID on June 30th of 2020. He was otherwise a healthy 65-year-old with no underlying health conditions. He was looking forward to retirement. He had been working here in Arizona, where I grew up, since he was 5 years old. He picked cotton, melons, and onions in the fields outside of Phoenix as a child with his immigrant parents from Mexico. And went on to go to high school and graduated from high school and started a family just 4 miles from where he grew up, and spent his entire life here working, got his associate's degree at a local community college, And despite the limitations of growing up in poverty, of going to only a community college, he was able to work in manufacturing at an aerospace industry. He was a lover of sports, of community, and was really looking forward to turning that page and starting retirement. Whereas I've heard folks say sort of that third chapter of life, that time in which you can finally put down your books and the time punch and enjoy some of those final years with my mother and my family. But that was cut short for him. He got sick in early June 11th. So we're approaching that 1 year anniversary for him, and spent 2 weeks in the hospital before he tragically passed away. Prior to losing my dad, I had worked in the advocacy world, actually working to educate folks on antimicrobial resistance, additionally working to pressure companies to stop tropical deforestation. I was no foreigner to the idea that we live in a very fragile ecosystem that is not separate from humanity. And that the more that we globalize, the more that we need to think of how do we advance our systems to support life, human life, like my father's, but also our natural life, this interconnectedness. When my father passed, I started to raise my voice here in the US to call for not only accountability of our government's response to the pandemic, but also to prevent pandemics in the future. We launched an organization called Marked by COVID, which is helping to share the stories of the tragic losses that we're experiencing across the globe, because every single one of those people leaves behind folks that are mourning and caring and were instrumental into our communities. With Marked by COVID, we have a constituency of literally thousands and tens of thousands of people here in the United States. We're growing globally as well, of folks who stand behind this movement, who stand behind this call to action to prevent outbreaks, prevent pandemics, and do the work to actually get at the source of spillover. We stand ready to support this action, whether that's calling our elected officials, writing letters, going to demonstrations, and being out there in the world alongside you. So if you ever needed to know what is at stake, and if you have the support of the public behind you, I am here to say yes. Yes, you do. Because people like me across the United States and the globe stand beside you. We know more than anybody else what is at stake when we fail to answer this call. So thank you so much for being here from the bottom of my heart. And thank you so much for being here on behalf of my father and everyone else we've lost from this current crisis.
Thank you, Kristin. I knew I didn't need wrap-up remarks because you just made them. This is an incredibly complex area. We have all kinds of multifunctional expertise that we need to bring to bear on a difficult problem, but the capacity of human engineering is limitless. And the collaboration we saw today is collaboration we need to mimic all over the globe. Thank you so much. We are not done. We've only just begun. And thank you to our attendees, and have a lovely day.